As individuals are now facing the biggest crisis of our generation, the decisions people and government take in the next few months will shape not just our healthcare systems, but also our economy, politics, and culture. We're not just fighting a pandemic, we're fighting an infodemic as it plagues the COVID-19 outbreak. Fake news and misinformation of data are easily prevalent in this digital age. As such, we are recognizing the danger of widespread sharing of medical misinformation, especially in a pandemic as it undermines the trust in health institutions and programs. Many short-term emergency measures will become a fixture of life, as such is the nature of emergencies. Since the COVID-19 situation happened in the Philippines, infodemic management was regarded with higher importance as it can affect decision-making processes when immediate answers are expected. Thus, the Philippines COVID-19 Infodemic Response Task Force was made composed of volunteers from national government agencies, development partners such as the World Health Organization and UNICEF Philippines, media and public affairs representatives, and the academy, with the Department of Health at the helm. For the pre-COVID-19 pandemic, the infodemic management system is arbitrary. There are no criteria set in screening which mis or disinformation to address, and interagency coordination on health rumor management is quite weak. Content-wise, however, the DOH has always been accurate and materials are thoroughly vetted by concerned technical offices. As infodemic management during COVID-19 has been prioritized, synergized coordinated efforts in addressing the mis and disinformation have been done by the various volunteers of the Philippines COVID-19 Infodemic Response Task Force. Infodemic management became one of the foremost pillars of the DOH COVID-19 communications campaign, dubbed as Be the Solution sa COVID-19, or translated, Be the Solution to COVID-19. The Philippine government adopted a more systematic, coordinated, whole-of-government approach in addressing dis and misinformation on COVID-19 related issues. The DOH is now looking towards upscaling this to cover all health-related concerns. As a result, a total of at least 57 fact-check materials on critical and urgent issues related to COVID-19, mis and disinformation were released by the department as of writing. Audiences are diverted to published policy documents or the DOH official website for access to more information and for issues that require elaboration and educational reinforcements. Subsequent explainer videos were also produced. These typically highlight actionable points for the public to follow. All finished communication materials are cascaded to our regional offices for localization and for distribution on the ground. The issue on tuob or steam inhalation as a treatment for COVID-19 stirred up controversy nationwide sometime in July, one of the most exceptional rumors or misinformation that confronted the DOH that requires immediate action. Many Filipinos, especially those residing in rural areas without immediate access to hospitals, practice the steam inhalation or tuob or the traditional method to relieve themselves of mild COVID-19 symptoms. Such practice was deemed harmful as it may prevent COVID-19 patients from seeking proper medical attention by relying solely on the method for a cure. It may also be a cause for burning accidents. The department released a series of materials to address this issue, utilizing various platforms in social media denouncing the use of steam inhalation as COVID-19 treatment. Through the COVID-19 virtual presser, an official release, an alamin Be in the Know card, or other social media materials. Content for these fact-check materials are reviewed by the professional medical societies for accuracy and translated to the vernacular for easy comprehension. Saturating multiple platforms with the same message was a key action to achieve such level of compliance and cooperation, as people need to trust public authorities. The media and the department made continuing efforts to debunk this myth. Thus, the issue died down. This simple action saves lives as the people of today seek to verify factual information. In a moment of crisis, minds too can change quickly as these are not normal times. It is not too late to rebuild people's trust in science, medical factual information, public authorities, and in the media. As we prioritize rumors to address, we make use of new technologies in the digital age to consistently saturate the publication of fact-check materials, as these information should enable people to make informed personal choices. As we fight infodemic, shifting the thinking from reactive to the preemptive, taking early measures are crucial as we need to share factual information, thus being the big advantage of humans over infodemic and viruses. Plant eyes in the community to develop responsive content tailored to local needs and language as we keep in mind those people vulnerable to mis- and disinformation. We need a spirit of global cooperation and trust as we collaborate and foster partnerships to expand reach as correct messaging is amplified and reinforced in people's minds. As we choose solidarity and responsibility in healthcare to fight through this pandemic, it will be a victory not only against this coronavirus infodemic, but also to the future epidemics and crises that might come.